Hi, welcome back to the video. This is section 5. How do we treat these problems? Well, to start, all treatment is based on testing. We treat what we find on your specific tests. That goes for everything, okay? If we find toxins or chemicals, we get them out of you using nutritional components, okay, or nutritional compounds. If we find infections, we kill them. If we find food sensitivities or food intolerances, we eliminate them from your diet. We counsel you from a nutritional standpoint on what you can do to continue to get better and improve and get healthy. Okay? If we find nutritional deficiencies from all the inflammation, we're going to support your body nutritionally, okay, to help eliminate those nutritional deficiencies. If we find musculoskeletal problems, either in your neck, your back, or anywhere else in your body for that matter, we're going to rehabilitate you. And in this office, we rehabilitate patients, okay? We utilize a combination of non-surgical spinal decompression. I'm sure you've heard of that. It's been advertised everywhere. It's extremely effective when it's used properly. The problem is that not a lot of people use it properly, okay? In this office, we use non-surgical spinal decompression, and we use it specific for the problem that you have. We also utilize things like active therapeutic movement machine. There's not very many of them in this state. We do have one of the units here. It is an exceptional rehabilitation product, or rehabilitation device, sorry. We use it to functionally stabilize necks, backs, hips, shoulders, knees. It can be used to rehabilitate any of these tissues structurally. We also use cold laser therapy or cold laser technology. Lasers have been researched recently as far as their efficacy and their benefit and how they work. Research shows that cold laser therapy increases mitochondrial activity. The mitochondria are the part of your cells that process glucose and oxygen and make ATP. ATP is the usable form of energy for the body. So if lasers, or when lasers activate mitochondria in the body, it's going to increase the output of ATP. The more ATP, or the more energy you have, the quicker you're going to heal. So that's why we use cold laser technology. We also utilize a number of other physical therapy modalities or physical therapy protocols or products, depending upon what's specifically going on inside your body. Okay? Getting back to treatments, if we find areas of neurological deficiency or neurological dysfunction, either in the body or in your brain or brainstem, we can rehabilitate those just like we would rehabilitate a weak or damaged muscle. Okay? Neurologic rehab is based upon the principles of what's called neuroplasticity. And that's basically your body's or your brain's ability to regenerate and grow. Okay? Think of a stroke patient. Okay? A patient has a stroke, or a person has a stroke, and they're unable to walk, they're unable to talk, they're unable to chew and swallow, they can't eat, they can't communicate, they can't really move all that well. But with the right type of therapy and rehabilitation, that person's able to, gain back all those functions that they lost as a result of the stroke. Most patients that have strokes rehabilitate fully, okay? And 6, 8, 10 months later, you'd never even know that they had a stroke to begin with, okay? And it's all based upon neurologic rehabilitation. So we can rehabilitate different parts of the brain or the brainstem using specific neurologic therapies like vibration therapy, eye lights, hemistim. We use a lot of metronome therapy or interactive metronome, which is a computer-based program to retrain the brain and the brainstem. In the body, throughout the body, in the periphery, neurological damage or neurological dysfunction with neuropathy or neuropathy-like symptoms in the hands and feet, we use the same type of neurologic rehabilitation. We can also use electrical modalities like rebuilder therapy. The rebuilder therapy actually emits an electrical impulse from one extremity to the other that stimulates normal nerve firing. Okay? The electrical impulse that's used is the exact same frequency of a normal nerve electron or electrical impulse. By volleying that impulse back and forth with the device, we're going to make the nerves fire. Okay? Every time you make a nerve fire, that nerve is going to get stronger, just like a muscle. Okay? Every time, let's say, for example, you damage a muscle. Okay, this will make more sense. Let's say you damage your bicep. Okay? The way you fix it is you go to rehab, physical therapy. And in physical therapy, they're going to make you use that weak muscle. Every time you move it or exercise it, that muscle fires. Every time that muscle fires, it gets stronger. The stronger it gets, the more normal it's going to function. And the same thing holds true for nerves. So if we're using something like, let's say, the Rebuilder, every time that electrical impulse makes that nerve fire, that neuron is going to get stronger. The stronger that neuron gets, the more normal it's going to function, and therefore the less symptomatology you're going to feel. So again, we rehabilitate neurological dysfunction just like we would rehabilitate any other tissue in the body. Okay. Again, all the treatments that we do in this office are based specifically on your lab results. There is no one size fits all in this office. Okay. It's all specific to the individual patient. That's why most people are still suffering with these conditions, because everything is done with a cookie cutter approach, okay? And unfortunately, that just doesn't work, okay? Patients with these types of problems need to be dissected. They need to be taken apart and looked at specifically, system by system by system, to figure out exactly what's wrong, exactly what's causing the problem, and then ultimately what needs to be done to get you better, okay? And that's what's done in this office. So I promise, again, no one's done this type of lab testing on you before, and unfortunately, without the testing, there's no way to determine the true underlying cause of your problem. Okay. Also, there's no way to determine exactly what needs to be done from a treatment standpoint to help you get better. Okay, and that's again what this office specializes in doing: identifying the cause of the problem, figuring out exactly where the damage is occurring, and looking at the lab results to figure out exactly what needs to be done, both from a nutritional standpoint, a musculoskeletal standpoint, and a neurological standpoint. And when you hit all three of those different aspects simultaneously, the patient is going to get better. And that's how I'm able to make predictable, make a prediction and establish some level of success with our treatment protocols. Okay. We basically leave nothing to chance. We're looking at everything. So again, that's just a little bit of about how the rehabilitation and how the treatment process works in our office. I hope that makes sense. If it does, stick around for part 6. We'll be right back. Thanks again. I'm Dr. Wilmich.